Our goal is to achieve the governor's target of 12,000 doses being delivered per day by the end of next week. On Tuesday, I described 5 actions OHA was taking to reach that goal. The first action was to simplify and speed up the phase 1A process. We want to get healthcare workers, first responders, people living in congregate settings, and others in that priority group vaccinated so we can move to education workers, critical workers, vulnerable populations, and the general public as fast as our supplies allow. Getting more vaccines in the hands of providers who are ready and able to vaccinate large numbers of people is a vital part of our strategy. OHA has delivered vaccine doses to 190 sites across the state already. We'll allocate vaccine doses to an additional 30 sites next week, including hospitals, local public health agencies, federally qualified health centers and rural health clinics, urgent care clinics, retail pharmacies, and emergency response agencies. I want to be clear. OHA allocates vaccines to sites, but they are shipped directly to these vaccine administration locations through vaccine manufacturers or the federal government. These vaccines don't pass through OHA's hands, but are routed immediately to the hands of vaccine administrators and the arms of people in Oregon. We know that many of these partners are working hard to enter their data on doses they've administered, but many have experienced significant data underreporting issues. Others appear to have significant numbers of vaccines on hand. That's affecting Oregon's statewide total to date. Here's how we're going to work to solve that problem. Yesterday, OHA staff called more than 100 sites to review their vaccination plans. We wanted to identify sites that are able to maximize throughput and assess their ability to distribute more doses if we allocated additional vaccines to these locations. Based on that information, OHA has adjusted the way we allocate doses to vaccine administration sites around the state next week. Sites with plans to administer the doses they receive within 7 days are being prioritized. We will also prioritize sites with the commitment and capacity to deliver high volumes of doses to healthcare workers, first responders, long-term care residents, and other members of the phase 1A group. As the governor indicated, one of those sites is Salem Health. Salem Health is conducting a mass COVID-19 vaccination clinic for members of phase 1A who live in Marion County, which has been hard hit with high COVID infection rates since the start of the pandemic. Members of the Oregon National Guard are helping to administer those vaccine doses. To support the effort, OHA is distributing 10,000 doses of Pfizer vaccine to Salem Health next week. Another step we announced on Tuesday was our intent to activate contracts with Part B of the Federal Pharmacy Partnership to dramatically expand and accelerate vaccinations in long-term care programs. This week, we formally activated Part B. As a result, federal pharmacy partners will begin receiving doses next week to vaccinate residents and staff in the expanded number of settings, including assisted living facilities, adult foster homes, residential treatment facilities, independent living facilities, and a variety of other congregate care settings. The first allocation of 19,500 doses to supply vaccine to this program will be made next week and shipped by CDC to pharmacies the following week at Oregon's direction. Consanus, Walgreens, and CVS are working hard to prepare plans to vaccinate the 75,000 staff and residents enrolled in this Part B program as quickly as possible. In addition, we said we would enlist retail pharmacies earlier than previously outlined in Oregon's vaccine distribution plan to make it simpler and easier for people in phase 1A to get vaccinated. Since Tuesday, Oregon took steps to activate retail pharmacies and gathered information about pharmacy sites enrolled with the CDC who are ready and able to process COVID-19 vaccines. Pharmacies participating in this program are located throughout the state and will provide much needed access points for independent healthcare providers and other groups without a clear point to access vaccine. We've identified pharmacy partners in all Oregon counties who will enable us to serve more of the 300 to 400,000 people in phase 1A sooner, as well as in following phases of distribution. We expect doses to flow to pharmacies across the state beginning next week. We'll detail additional steps under our other priority actions, including other locations where we're prioritizing and reallocating doses next week.